Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Today I want to tell you about a large French cancer study that was published in the American Association for Cancer Research Journal in July of 2018. Now, this study followed almost 42,000 participants who were living in France, age 40 and older, who had not been diagnosed with cancer prior to the start of the study. So the researchers closely followed the participants' dietary practices for almost 8 years, from May 2009 to January 2017. Now, during that period, there were 488 breast cancer cases that were diagnosed, 222 prostate cancer cases, and 118 colorectal cancer cases diagnosed during the study period. Now, the study showed that individuals who best complied with the nutrition and lifestyle recommendations outlined by the American Institute for Cancer Research showed the very best cancer prevention outcomes. So it appears that these cancer authorities know what they're talking about. So people who followed their recommendations did better than individuals who followed other popular dietary programs, including the Mediterranean diet, which is very popular, as well as the alternate healthy eating index and the French nutrition and health program. So the study showed that a 1-point increase in the American Institute for Cancer Research score was associated with a 12% decrease in overall cancer risk, a 14% decrease in breast cancer risk, and a 12% decrease in risk of developing prostate cancer. So here's a quick summary of the 7 key nutrition and lifestyle recommendations published by the American Institute for Cancer Research. They obviously know what they're talking about. These are 7 key points of their recommendations. Number 1, remain at a healthy body weight. Number 2, be physically active. Number 3, eat a diet rich in whole grains, vegetables, fruits, and beans. Number 4, limit consumption of fast foods and other processed foods that are high in fat, starches, and sugars. Also, limit consumption of red meat and processed meat. Red meat and processed meat. Limit the consumption of sugar-sweetened drinks. And number 7, limit alcohol consumption. Now, regarding alcohol, one of the researchers of the study commented that avoiding alcohol was most likely a major contributing factor to the reduced risk of cancer seen in the participants who adhered to the American Institute for Cancer Research's recommendations. The researcher said, the findings in this study augment recent research that implicates alcohol as a risk factor in many cancers. In their last report, the World Cancer Research Fund stated that there's now strong, convincing evidence that alcohol consumption increases the risk for oral pharyngeal cancer, that's cancer of the mouth and the throat, cancer of the esophagus, liver cancer, colorectal cancer, postmenopausal breast cancer, and there are also strong associations between alcohol and risk of stomach cancer, postmenopausal breast cancer, as well as prostate cancer. So I think it's important to point out that the Mediterranean diet allows or encourages some regular alcohol consumption to help reduce the risk of heart disease, but this may actually underappreciate the increased risk of cancer that's associated with that level of alcohol consumption. Now, from the study results, the researchers conclude the following. A diet that encourages both healthy eating and physical activity and discourages alcohol consumption was associated with a reduced overall cancer risk as well as lower breast, prostate, and colorectal cancer risk. The World Cancer Research Fund and the American Institute of Cancer Research estimate that in developed countries, about 35% of breast cancer and 45% of colorectal cancers could be avoided by better adherence to more prudent nutritional recommendations. So let me repeat again the recommendations one more time from these leading authorities who obviously know what they're talking about. They've been studying the relationship between diet and lifestyle and genetics and cancer for many, many years now. These 7 points, each of them plays a very important role in cancer prevention. Remain at a healthy weight. Be physically active. Eat a diet rich in whole grains, vegetables, fruits, and beans. Limit your consumption of fast foods and other processed foods that are high in fat and starches and sugars. limit your consumption of red meat and processed meats, limit consumption of sugar-sweetened drinks, and limit alcohol consumption. Now, I've included the research study references in the text below. Thanks for watching, and I'll see you next time.